Hello dear friends, I Dr. Shamsher Singh welcome you all to my Pharma learning channel, and today again I am going to discuss with you about next GPAT series. Hope this will also be very useful for you all to appear in the GPAT exam. So next questions in this GPAT series are: which of the following drugs may inhibit the hepatic microsomal P450 enzyme responsible for warfarin metabolism? The options for this question are cimetidine, ethanol, phenobarbital, and procainamide. So you can choose the correct option for this question and you can comment in the box. The correct option for this question is cimetidine. So this cimetidine, it inhibits the hepatic microsomal P450, and this cimetidine interfere with the warfarin metabolism in the body. This is a first option. Now the second option for this cimetidine is having a anti-androgenic effect and known to cause gynecomastia in the human beings. So that's why this cimetidine was banned in the India. So you are welcome to Pharma Learning channel. And the next question for this series is phenylephrine causes. The options are constriction of vessels in the nasal mucosa, increased gastric secretion and motility, increased skin temperature, and meiosis. You can choose the correct option very fastly for this question. The correct option for this question is constriction of vessels in the nasal mucosa, because this phenylephrine is a alpha agonist. So basically alpha 1 agonist, the drugs which are responsible for the constriction of blood vessels, because the alpha 1 receptor, which is a GPCR type of receptor, which act through IP3 DAG pathway and increase the level of calcium. So calcium dependent smooth muscle contraction is the mechanism. So this is a correct option for this question. The next question for this series is pre-treatment with propranolol will block which of the following? So the option for this propranolol are methacholine induced tachycardia, nicotine induced hypertension, norepinephrine induced bradycardia, and phenylephrine induced mydriasis. You can choose the correct option very fastly. Which one is the correct answer for this question? The correct answer for this question is methacholine induced tachycardia. So this propranolol, which is used for the treatment of supraventricular tachycardia, it is an antiarrhythmic drug also, it is an antihypertensive drug also, and it is a non-selective beta blocker, propranolol. So propranolol is used as a drug which will block the methacholine induced tachycardia in the heart. Next question for this series is nicotinic sites include all of the following except. It means question can be nicotinic receptors are present on the following sites except. The options are bronchial smooth muscles, adrenal medullary cells, parasympathetic ganglia, and skeletal muscles. You can choose the correct option, correct answer for this question, that nicotinic receptor will not be present at following part. The correct answer for this question is bronchial smooth muscles. So that means this nicotinic receptor, which is a type of cholinergic receptor, which are a GPCR ion gated receptor, which work through potassium, sodium, and calcium influx, they are not present on the bronchial smooth muscles. So the next question for this GPAT series is a molecule that stimulates nitric oxide synthase especially the enose isoform is the molecule that stimulate nitric oxide synthase, that is enose isoform is. The options are acetylcholine, citrulline, isoprotrinol, and nitroglycerin. You can choose the correct answer for this. The drug which increase the nitric oxide synthase, the correct option for this question is acetylcholine. So acetylcholine stimulate nitric oxide synthase, particularly in the endothelial cells of the blood vessel, and by increasing eNOS expression in your blood vessel, it reduces the blood pressure and the pressure over the blood vessels. So acetylcholine is a vasodilatory in nature. So this is a correct answer for this question. The next question for this series is, which of the following statement about toxicity of local anesthetic is most correct? The options are: serious cardiovascular actions are more likely to occur with tetracaine than with bupivacaine. Most local anesthetic cause vasoconstriction. Intravenous injection of local anesthetic may stimulate ectopic cardiac pacemaker activity, that is SA node activity. Overdose of local anesthetic cause hyperventilation, is helpful to correct acidosis and lower extracellular potassium. So you choose the correct statement for the local anesthetic. Which one is a correct? The correct option is overdose of local anesthetic cause hyperventilation, is useful to correct acidosis and lower extracellular potassium. So you know this thing, that local anesthetic, if we use, then they are useful to lower the acidosis, because they increase the entrapment of oxygen at that particular area and increase the level of antioxidants. So these local anesthetic lower the extracellular potassium. So potassium level is lowered by local anesthetics. Now the next question for this series is, use of this agent is associated with high incidence of disorientation, sensory and perceptual illusions, and vivid dreams during recovery from anesthesia. So you will choose the correct option. Which one will be the agent responsible for these all things? The options are fentanyl, ketamine, diazepam, and midazolam. You can choose the correct answer for this option. The correct answer is ketamine. So ketamine, whenever we give to any animals during the surgery, the animal during the time of recovery suffer from these things: disorientation, sensory and perceptual illusion, and vivid dreams. So clinically it has been reported that ketamine is called as a dissociative anesthetic. This could be a second answer. So dissociative anesthetic is called as a ketamine, and hallucinations are produced by using the ketamine. So ketamine is a correct option for this question. So the next question for this series is, which of the following drug is the drug of choice in anaphylaxis associated with bronchospasm and hypotension? The options are epinephrine, isoprotrinol, corticosones, and norepinephrine. You choose the correct answer for this option, that which drug is a drug of choice in anaphylaxis associated with bronchospasm and hypotension. The correct option is epinephrine. So epinephrine is a drug of choice in case of anaphylaxis whenever the patient suffer from bronchospasm, because epinephrine dephosphorylate the myosin light chain kinase and inhibit the smooth muscle contraction in the bronchial area. And the second thing, epinephrine was old time, not nowadays. but was preferred a first line agent for the hypotension whenever the patient was suffering from low heart rate. So reduced cardiac output was increased by using epinephrine, and the third option for your GPAT is epinephrine is a negative inotropic agent because it increases the oxygen consumption by the heart. So this is a correct option for this question. The next question for this GPAT series is accepted therapeutic indication for the use of antimuscarinic drugs include all of the following. The options are hypertension, motion sickness, Parkinson disease, post-operative bladder spasm. You can choose the correct answer for this question. The correct answer is hypertension. So, antimuscarinic drugs do not use in case of hypertension. The reason is antimuscarinic drugs sometimes cause increase in the heart rate and they also interfere with the QT interval. So some of the agents which are antimuscarinic can prolong the QT interval or can be responsible to increase heart rate by interfering with the total peripheral resistance. So this is a correct answer that antimuscarinic agents are not used for this particular condition. The next question for this GPAT series in the Pharma learning channel is avidin, a protein found in egg white area of the egg, is an antagonist of biotin, pantothenic acid, choline, and pyridoxal. So you choose the correct answer for this question. The correct answer is biotin. So you know that streptavidin, one of the thing is a streptavidin plus biotin. This is used as an antibody for the immunohistochemistry. So that means whenever the avidin and biodin complex is formed, this is a irreversible type of complex. The second option in the GPAT, if you see there, which type of complex is formed by avidin and biodin? This complex is a irreversible type of complex. So this is a correct answer for this question. The next question for GPAT series in the Pharma learning channel is select the drug that is indicated for cardiogenic shock from the following list. So you choose the correct answer. The options are dobutamine, sotalol, amiodarone, and amlodipine. You choose the correct answer very fastly. The correct answer is dobutamine. So dobutamine is a drug which is a drug of choice in case of cardiogenic shock whenever you know that heart is going toward failure state. So to increase the pumping of the heart, we use dobutamine. So it is more effective than dopamine. So this is a correct answer for this question. The next question for this GPAT series is select one of the drug which produce smooth muscle relaxation. The options are nebivolol, atenolol, acebutolol, and labetalol. So the correct option you can choose for this question, the correct answer is labetalol. Labetalol is a useful drug which is a antihypertensive drug, and labetalol is having a additional property that it causes smooth muscle relaxation by reducing the calcium ion entry. So it reduces the inhibiting the calcium ion, so calcium dependent smooth muscle contraction is inhibited. So it is having a dual property in our body. So it is also preferred as a antihypertensive drug. Next question for this GPAT series is the important effect of natriuretic peptide in heart failure is. Options are increase sodium excretion in the kidney, release aldosterone, release antidiuretic hormone ADH, vasopressin, and release antidiuretic hormones. Now the correct option for this question you can choose very fastly. The correct answer is increase sodium excretion in the kidney. So this is very important. Another question can be asked in the GPAT that how natriuretic peptide increase sodium excretion in the kidney. The correct answer is they reduce or inhibit the renin release. So by inhibiting the release of renin, the natriuretic peptide increase the sodium excretion in the kidney and they are useful as antihypertensive agents. You are welcome to Pharma Learning channel. You can like, subscribe this channel. And the next question for this series is the activity of cardiac glycoside is mainly due to. The options are steroid moiety, glucose moiety, lactone moiety, and all of the above. Very fastly choose the correct answer for this question. The correct answer is lactone moiety. So this question can be asked in this way that on is carbon 17 which moiety is present responsible for cardiac glycosidic activity. So this lactone moiety is present in a structure of this cardiac glycoside on a carbon atom 17. So this is a correct answer for this question. The next question for this GPAT series is the drug corresponding to letter O in the RCHOP regimen used for chemotherapy of lymphocytic leukemia is. The options are omalizumab, ondansetron, vincristine, and prednisone. So you can choose this O, onivirin, which is O letter is used. The correct answer for this question is vincristine. So onivirin, that is O letter which is used on the brand name of this vincristine, and vincristine is used for the treatment of lymphocytic leukemia, a type of cancer. The next question for this GPAT series is select the incorrect statement. The options are resistance toward 6-mercaptopurine 6-MP is due to alteration of HGPRT. Allopurinol increase the action of 6-MP. Azathioprine is a prodrug of 6-MP and 6-MP is given with the leucovorin. So you choose the incorrect, wrong statement here. The wrong statement here is 6-MP, 6-mercaptopurine is given with leucovorin. So if you give the 6-mercaptopurine with leucovorin, leucovorin is an antagonist. It will antagonize the effect of 6-mercaptopurine and that's why its action can be reduced. So this is an incorrect option for this question. The next question for this GPAT series is rituximab is a particularly used for. The options are breast cancer, prostate cancer, B-cell lymphoma, and renal tumor. You choose very fastly the correct answer for this question. The correct answer is B-cell lymphoma. Rituximab, which is a type of antibody, it is preferred for this type of cancer, that is a B-cell associated lymphomas. So this is a correct option for this question. The next question for this series is select class 2 antirhythmic agent from the following. Options are diltiazem, lidocaine, propranolol, and verapamil. So which one is a class 2 agent? You answer very fastly or comment in the box. The correct answer is propranolol. So propranolol, which is a class 2 type of antiarrhythmic agent, is used for the treatment of supraventricular tachycardia. So it means it minimizes the heart rate and improve the oxygen demand of the heart. So this is a correct option for this question. The next question for this series is identify one of the agent that is considered as a class 5 antiarrhythmic drug. The options are propafenone, diltiazem, adenosine, and lidocaine. Very fastly you answer this question or comment in the box. The correct answer for this question is adenosine, and this adenosine is a class 5 antirhythmic agent. You know, it is also used to treat the, you can say, arrhythmia and arterial ventricular flutters, ventricular fibrillations, and tachycardia. So this adenosine is a useful agent as a class 5 for arrhythmia. The last question for this GPAT series is the action of natriuretic peptide on kidney involves. The options are dilation of afferent arteriole, dilation of efferent arteriole, constriction of afferent arteriole, and release of aldosterone. You choose the correct answer for this last question. The correct answer for this question is dilation of afferent arteriole. So the natriuretic peptide, which are also called as a atrial natriuretic peptide, they are useful as a for dilation of afferent arteriole because they inhibit the sodium, they increase the sodium excretion, they inhibit the renin release, they inhibit the angiotensin formation, and by inhibiting the angiotensin they are useful as a dilation for the afferent arterioles. So these were the questions I have discussed with you. So you can like, subscribe, and watch this Pharma learning channel. Hope this series will be very useful, and in the coming lecture I will discuss more and more question with basic concept about the other subject also, so you can prepare yourself. You are welcome. Thank you very much.